Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Today in Neighborhood Health Watch, the shocking facts about obesity in America and ways to help if weight control is your problem. Experts say too much food and too little exercise are the main reasons. And even though we have much to celebrate with healthier restaurant menus and a country addressing food deserts, the nation's weight problem has become jaw-dropping. Dr. Matthew Brengman, he is medical director for weight loss services with Parham Doctors Hospital. He's here to talk about it on First at 4. Thanks a lot for joining us. We appreciate it.
Thanks, man.
What's driving America's weight control problem, and how bad is it?
Well, the problem is very serious. We see about a third of Americans who are suffering from obesity. About a third of those people are candidates for surgical weight loss, and so that's a tremendous increase over the past 20 years. We see obesity as a combination of a genetic and environmental effect. We are programmed to eat for survival, and around us there's a tremendous amount of food, and that food is specialized for us so that we want to eat it.
You know, women are often fat shamed in the media for being overweight, but statistics really show that men are more overweight than women are, and as a result, I guess we need to look at situations or solutions for both.
Absolutely, and the problem is even worse because women pursue weight loss services much more than men, even though men may be disproportionately affected in their health by their weight. And so we see a tremendous number of men suffering from things like sleep apnea and sudden cardiac death, which are preventable with treatment for weight.
What are some of the non-surgical procedures to address the problem?
Well, weight loss always begins with diet. So we always want to counsel people on a healthy diet, healthy patterns of eating, correct disordered eating, single large meals, getting people to eat 3 small meals per day. There's an increasing number of medications available now. Medications are getting better. Not quite there. People can lose about 10% of their total weight. For some people, that's plenty. Others, that's not quite enough. And then we move into procedures for weight loss.
Talk briefly about the balloon, the ORBERA Intragastric Balloon.
The balloon is super exciting because we've had this wide divide between traditional surgery, gastric bypass, gastric sleeve, which is permanent. It's a surgical intervention. There's some recovery. And then we've had medications that just aren't quite as effective for those people who are 50 to 100 pounds overweight. And the balloon really sits right in that middle zone. It's a temporary procedure.
That may be the answer to a serious problem.
Absolutely.
Thank you so much for joining us. We appreciate it.
My pleasure.